Building downtown. Building downtown.
Hey, this is The Building Downtown. Don't forget to follow us on social media at The Building DT. Don't forget to follow and subscribe on YouTube, iTunes, Spotify, Google Play, wherever you get your podcasts from. I'm your host, Jason Kelly. You can follow me at JKellyMMA. Joined as usual by my co-host, Kirill Kasatskiy. Follow him at Apostle Raps. And Amy Barton, unfortunately, could not be with us today. She's traveling. But we do have a good replacement, actually, to come in and kick it with us for a little while. You may know this man if you're on the Ontario combat sports scene. You definitely know this man. Kid not good for kidney disease. You may know him from that. You may know him from the world of medicine. Without further ado, let's bring in Dr. Faisal Rehman. How's it going today, my friend?
Hey, Jason. Thanks so much for having me on, guys. It's great to be here.
Yes, we appreciate you. Appreciate you lending some time. Last time we spoke was... I think the craziest thing going on was Evangelista Santos got hit with that flying knee from Michael Venom Page and caved his skull in. How the times have changed. We're living in 2020 is a challenging time for everyone, especially with this COVID thing going on. And it's affected everyone in some way or another. But you're in a unique position where you work in healthcare. How has it affected and disrupted your life in terms of professional speak, like your professional career?
You know what? The COVID crisis has actually, in my opinion, done more to affect patients who don't have COVID. And what I mean by that is taking care of patients who need knee replacements or hip replacements, who have autoimmune diseases or whatever it may be. It has become very challenging to manage them in the hospital setting, and people are suffering. People are suffering a lot. You know, my job has become a bit more stressful for sure, but compared to what our patients are going through, there is no comparison. You know, I had a patient of mine who had already waited a year to get their hip replacement, only to find out that was going to be canceled for several more months because the ORs had shut down when COVID was first an issue in March of this year. And so it is surreal. Patients have suffered a lot. Businesses have suffered a lot. The places where I used to get my dry cleaning done, get my breakfast, many of them have gone out of business. I can't tell you how many business owners I've run into who are in tears as soon as I enter their facility because their whole lives have been disrupted by this and they're in financial ruin. So I think it's important that we show compassion for patients who have suffered from COVID and try and deal with this. But from my perspective, I've seen the non-COVID patients suffer a lot.
Really, eh? And when this thing first started coming on, the reason I thought about this is because obviously I've lived in Southern Ontario my entire life. I remember the SARS scare quite well. And a movie that came out afterwards, I've watched it tons of times. I think it's a great movie. It was a CTV movie about the whole SARS thing. And they showed how once it was in the hospitals, they didn't know exactly what they were dealing with. And it kept getting diagnosed incorrectly. And then once they realized we got a different kind of monster on our hands here, the fear and the concern of the unknown in the doctors and the nurses within the hospitals, is that kind of the vibe that happened in healthcare around here with this stuff that came on? Like, what was the feeling
Jason,
like? Sorry, go ahead.
Let me tell you, buddy. This is way worse, and let me explain why. SARS is quite deadly. It's a virus that again can affect the lungs, much like COVID-19 can. And it had a high mortality rate. There are other viruses that have very similar mortality rates to SARS, if not higher. The mortality rate with COVID-19 is much less. The problem is it's very, very contagious, very transmissible. And if you're a vulnerable patient, meaning someone who's older or obese or has multiple medical problems, it can be very deadly. And it spreads very easily. And that's what's made this more scary and challenging. It was relatively more difficult to contract SARS or some of these other viruses, but the COVID-19 virus is very, very infectious. And so, and it's true, the vast majority of, let's say, young people who get it may just sail through, have a bit of a cold, get a little sick, and then recover. The problem is then when they visit their grandparents or they visit their loved ones, it spreads like wildfire, and our vulnerable patients are the ones who suffer. So SARS to me came and went. As a physician, anyways, in my business, and businesses didn't suffer. Financial ruin didn't happen to a lot of people. You know, it came and went, and this is having a long impact, and it may continue to have an impact for the next year or two.
hmm And when it first came in, and we started having lockdowns and things like that, did you expect it to go this long or even longer, or did you think it was going to be
You
more like a
know,
SARS thing, in and out?
I was hoping. I was
Hmm
hoping, and I think, we were learning as we went, right? There's a shortage of of personal protective equipment. We didn't have enough masks. We still don't have enough hand sanitizer at times. We're constantly running low on all of these things that we need to be able to operate safely in the hospitals. But I have to tell you, I'd hopefully this will be an issue for 3 months. Then I said, okay, hopefully it'll only be an issue for 6 months. And now, as it's gone on, even if a vaccine is developed, I think we're going to continue to feel the impact for a minimum of a year, if not longer.
Hmm.
Bill Gates was saying that they expect the effects to be until 2022 in one of his interviews. But I was just going to ask you about the vaccine. As far as I know, there's no vaccine for SARS, right? They kind of stopped it because they couldn't figure it out. They couldn't.
Yeah, so there are some promising vaccines in development, and in fact, very promising in that it appears that patients are developing good antibody responses. So you have to develop an antibody against a pathogen for it to neutralize it and be effective and prevent infection. And it appears with some of these early vaccine studies that they're pretty effective at generating an antibody response. But obviously, testing still has to happen. We have to make sure the vaccine is safe and effective. And that, you won't know for about a 6-month period at minimum, I would say. So the vaccines are promising, but are even when they come out, there's going to be a delay in terms of their efficacy. So I still think, kind of what you were saying of 2022, that even with a vaccine, this isn't going to disappear. This is going to continue to be a problem.
I thought that this thing mutates so much that the creating vaccine for it will be pretty much impossible because now they have like 30,000 strains or something.
So, well, viruses can mutate. It appears though that once you have had the infection, the COVID-19 infection, you're less likely to reinfect. So that is a promising thing. Now, people have been reinfected. There are cases of patients who have had developed COVID-19 infection, recovered, and then developed it again. But that's very rare. But this is a main concern about cold viruses, is that they can sometimes mutate, and it's not so much that they mutate, but you lose your immunity a year later. So, for example, let's say you get a cold today from a virus, right?
Yeah.
Next year, that same virus can cause you to get a cold again. And part of the reason for that is you lose your immunity over time, right? And it's not that the virus is mutated; it's just that you no longer have maintained that immunity. So these are all very great questions that you're asking, and real concerns. And we're learning as we go. This has been a real life learning experience. We did not really know about social distancing and masking in the early days, the importance of it. And then obviously I think it's what saved Canada. I think we have done a lot better than many other countries because of this. And now with the second wave, mainly that's a function of us having to try and return our lives to normal, having our kids in school, for example, and opening up the universities. This has caused a bit of that second wave. And we have to ask our younger students to stop, do their best not to have unnecessary large group parties and such, because that's just going to make matters worse. That's why we're seeing an increase in the numbers, at least in London, and I'm sure in many other cities in Canada.
What about you just mentioned how the countries handled it. I don't remember Switzerland or one of the S countries. I forgot the name. I was getting ready for this and I forgot. One of the countries there, they saying that they beat it with the herd immunity. They never shut down anything. Obviously, they took some precautions as like old people were taken care of better, but they never even shut down bars. And it peaked out, and now their rate went way down. They're lower than everybody else in Europe.
And that's a fair question. Let me tell you one thing though. This approach of let's get everyone infected and then everyone will be protected could be disastrous. In Italy, for example, there were people who were dying left, right, and center because the healthcare system could not take the huge onslaught of patients that hit their hospitals. People were sharing ventilators. Can you imagine? You're putting your loved one on a ventilator and sharing with someone else. And it was just horrible. People were dying in the hallways of the hospital. We trained a number of the physicians in Italy in nephrology, and they were messaging us saying that they're in a living hell. Okay, so one of the problems with just letting everyone get infected is your healthcare system cannot handle that volume. And I don't know a lot about Sweden, but I suspect Sweden is not overpopulated. They have their housing is not in close contact, so perhaps they were able to navigate it for those reasons. But if you do that in China or any other large country, you're asking for trouble. And this herd immunity crap that people are talking about, our healthcare system will not be able to handle it. I think by minimizing exposure, what we are doing is controlling the number of cases and preventing a huge onslaught of patients that our healthcare systems cannot would not be able to handle.
It seems like these are the questions that everybody is asking because everybody wants to go back to work for everything to open up, right? So, and you seemed like the right person to ask that, and you see it as expected. You said that it could be disastrous in bigger crowds, right? So Switzerland or
and these are great questions. I think it's a great question, but I think people are always looking to want to return to normal. I want to return to normal. I want to travel around the world and do things that I enjoy, and everyone's life has been affected. And first and foremost, my feelings are not for traveling and the hobbies and stuff, but I'm more worried about our small businesses and our entrepreneurs who are suffering. I mean, that's got to be a priority of maintaining many businesses. But outside of that, if I have to not travel for a few months or a year or two, even if I have to inconvenience myself, so be it, because we have to protect our citizens. We have to protect our older patients.
It's not only, you know what I mean? It's always about the economy too, right? The country as a whole is going to suffer. Look at states that they turned into like a flaming garbage bin at this point.
Yeah, but remember what's happened in the United States is their administration did not take it seriously. They kept businesses open. They opened up Vegas. They opened up all these things. Look what's happening there now. People are dying. A lot of older patients, but they're dying left, right, and center. They've had over 200,000 deaths. Okay, so at what cost do we open up the economy fully? Right? At what cost is that? And at least in Canada, we're taking a measured approach. We're trying our best to keep the schools open. We're trying our best to keep restaurants open. We're social distancing in the restaurants. I still go to despite I see the consequences of COVID-19. I still try and support my local restaurants. I eat out more than I've ever eaten out before. I use Uber Eats all the time, just trying to pour whatever small money I can into the economy and support businesses. I've kept going to my dry cleaner. I think all of us who can afford to need to invest in our small businesses and spend your money and help support all of your local businesses, because those should be our priority to keep open. But returning life to normal, we have to deal with this first before we can return back to normal.
And the age we live in with social media and everything, everyone can get access to whatever they want. There's so much misleading information out there. Is this one of the more dangerous things that we're dealing with as well? Because I see people sharing absolute nonsense on a meme and people commenting on it thinking that they're hearing it from a very credible source. And I figure that has to cause some sort of problems in trying to get over this with people feeding into the misleading information. Is that more of an issue now than ever?
100%. There's so many conspiracy theories. And the scary part is that some of these people are well educated. It's not just people who are not educated. Well-educated people are saying this is a conspiracy. People want to control the economy. This was done on purpose. Somebody engineered the virus. And the nonsense goes on, right? And then I'm also dealing with the anti-vaccinators. Vaccines don't I'm never going to take that vaccine when it comes out. I don't believe in vaccines. Well, you can go back to the 18th century and die of smallpox. It's just stupid. So I get so frustrated, right? So we've been dealing with that before COVID-19, and now with COVID-19, it's gotten a lot worse, right? So I think unfortunately we have to battle this with education and do our best to stop these kind of ancillary information sources from working. I mean, you saw it on the news, even in the United States, people saying masks are killing people, and there's just mass hysteria. And part of it is our leadership needs to be more responsible. In Canada, we're blessed with excellent leaders. I'll just say it out here. I'm a liberal, but I have to say the mayor the premier of Ontario, conservative, has done a wonderful job. I give him full marks for how he's handled this crisis, Premier
Yeah,
Ford.
we'll get the gold
So,
star for sure.
and I would support him. In fact, he's done such a good job.
Doc-
I would vote for him as a liberal Democrat. I would vote for someone like that. In the United States, they have shitty leadership, right? They have people who are just speaking nonsense and are truly doing so much harm, and in some part are responsible for the over 200,000 deaths that have happened in that country. Wearing a mask and social distancing would have probably saved tens of thousands, if not hundreds, 100,000 lives.
Yeah.
That's my opinion.
Yeah. For you, how has your role changed at all? Like, have you been involved in any sort of programs or study groups or whatever it may be, assisting with other parts of Canada or even other parts of the world since this has started?
So I'm the site chief of medicine at University Hospital, the London Health Sciences Center. So I've been involved at the administrative level in terms of helping formulate operation plans that will help prevent the spread, and I help deal with some of our employees who get infected and try and deal with those things. So a lot of my responsibilities are local,
Okay.
but certainly there are other people like infectious disease specialists within our hospital who are part of nationwide groups that are trying to develop an overall approach in Canada. And Dr. Michael Silverman, who's one of my colleagues, has led some of those roles. Our infection control doctor, Dr. Michael Payne, is another person who has an impact more than just locally. Also, within our communities, our local community health organizations like Dr. Mackey and others in London, but others, our local health authorities are also playing a big role in terms of making sure that Middlesex region and all of the smaller communities are having a good approach to making sure that testing is available and that people are aware of what guidelines to follow to prevent infections.
And in your career, have you ever seen anything like this? Like, from the way you're explaining it, it seems like it's all hands on deck. Everybody has added a little more to their plate, and they're all working together. From what you were just explaining, anyways, with the names, is that kind of what it's like? And have you ever seen anything like that in your career?
Don't get me wrong. In the beginning, it seemed highly disorganized, very frustrating. We couldn't get enough N95 masks or protective gear for our patients. So we were given a shortage of gowns. I'm wearing, we are wearing, in my opinion, suboptimal gowns now, even because there's such a shortage to try and manage our patients. So we've done the best we can, but we need our partners in industry to really pump out more masks, pump out more gowns, pump out more hand sanitizer so that we can keep ourselves well stocked. We are in better shape now than we were 2 months ago, but it's still not ideal. And, it's a complicated healthcare system, too. We have medical students, residents, nursing students, nurses who we need to keep training. And all of these people need protective gear. So it's not, so we need to make sure we keep pumping that stuff out. And I think as this pandemic has progressed, I do credit our leaders for getting us in a better position than we could have been in. And I think it's saved tens of thousands of Canadian lives. There's the strategies that we've put into motion.
That's good to hear. Do you think that it's ever going to life will ever go back to normal in terms of like at the grocery store now, there's arrows on the floor. Do you think that's just the way life's going to be now, just to prevent something like this from ever happening again? Certain amounts of distance.
That's what I'm. Part of me is wondering. I agree. I think this could be a long-standing process because people are going to be afraid. So even if COVID-19 disappeared, when's the next? People are going to be concerned. When's the next pandemic going to hit? And it used to be odd. You walk into the grocery store, somebody was wearing a mask, you kind of noticed it. Now you notice it if somebody doesn't have a mask on, right?
I know.
It's so bizarre and surreal. And I pray that things return to normal. Like, I love sports, as you know. I love combat sports. When are we going to be able to hold a big event where we have 5,000, 10,000, 20,000 people in an arena watching a good fighting event? And so just trust me, I want to go back to watching music concerts, to traveling, to doing things I enjoy. And I don't know when that's going to happen. And I don't know when the social isolation rules are going to be relaxed. And I don't know when people are going to stop wearing masks. it's for sure interesting times, and I think the impact of this, even when this virus is hopefully in the past, I think it's going to be, like you said, a lasting impact. I can tell you, just at the university level, I teach at the medical school and at the university. I think things are going to be virtual for a long time, and so when can we get back into having 140 students in one classroom where we can interact with them and teach them? I have no idea.
Have you had to give a virtual lecture yet?
Oh, I've given tons of them. Everything's gone virtual. And in fact, one of my responsibilities, I helped develop the Clerkship curriculum and the undergraduate medical curriculum for kidney disease. And it's required a whole restructuring of how to develop this virtually. You can definitely deliver a lot of material virtually, but how do you teach a student to listen to the heart properly? Or how do you actually teach them to do a proper physical exam without doing it on a real patient? Video technology will only take you so far. So it's definitely had an impact on our ability to train future doctors.
And speaking of local businesses going under, one that's switching gears a little bit here, one that's closer to us anyway, a lot of people, except for the people directly involved in it. Parabellum MMA at Lyndon Whitlock, Roy McDonald, home to Josh Hill, has shut down now due to COVID restrictions and the government's response and multiple other things. What have you heard or seen in terms of the way it's affected the combat sports world around here and the smaller gym owners?
I feel, I never trained at Parabellum, but all of those guys are great young men, and I feel for them. I think they really gyms have been really adversely affected by this pandemic. Mm-hmm. And there's a number of boxing gyms as well that have unfortunately gone bankrupt. And the gyms that are surviving are the ones that are flexible in their business approaches, the ones who are running Zoom classes, the ones who are redesigning their gyms to meet social distancing guidelines, the ones who have put in screening processes in place to make sure that people who are entering the gym are doing so in a safe manner, and have diversified the way they conduct their business. So I think that's why some of the gyms will survive. But 100%, this has been devastating to the combat sports world. Athletes are not competing. The Olympic Games may be canceled, and there are a number of boxers who are really going to try and make the qualifiers and then go to the Olympics in Tokyo. So it's been devastating for athletes because their careers have really been put on hold.
Yeah,
and for the gyms as well.
Yeah, and in London too, it goes, and not just London, other places. It goes deeper than just mixed martial arts. London is a hotbed around here for mixed martial arts and combat sports, but you also have the London Knights. You got the university teams, sports teams, and stuff. There's a lot of athletes that are in London, in the London area, that can't do anything right now except for jog down the sidewalk, basically. And for people who are playing organized sports of some level, whether it be collegiate, a junior B hockey team, whatever it may be, regional MMA fighter. Yeah, I mean, you're not going to be able to be active for quite some time.
And I know, and so I think there was I'm not as familiar with the hockey scene, to be honest with you, but in mixed martial arts, I know a couple of the guys went to Montreal. I think there's an amateur league there that's operating back up again, which with some risk, I think, but yeah, it's been devastating, and the impact on the athlete is huge. Depression, anxiety is up among some of the athletes that I work with, and when you can't do what you love, it's going to negatively affect your quality of life.
Yeah,
that's awful, and then that affects your relationships and with others, and it's just it's been a very trying time.
Yeah, it's something Lyndon Whitlock mentioned when I spoke to him about how, obviously, by no means was he complaining about people being sick. His beef was with the government's response. And he's saying that, you got to look out for these people who are sick now, but by taking away the livelihood of athletes or small business owners, you create new health problems like depression, as you just mentioned, and other things that go along with that. So there's a ripple effect that goes outside of this as well. That's not just, the coughing and the symptoms of COVID. It's the mental health, as you just mentioned, and so many other aspects.
Well, 100%. I think it's devastating. I still don't know how we could have done something different than what we did, though, or what the government did. I mean, I completely agree with Lyndon. You know that the impact on the mental health of many people, not just combat sports athletes, but small businesses and others, has been devastating. But I don't know what the right answer is in terms of how better we could have done this, because I tell you, you know, if you saw what happened in other countries, in China and then in Italy, you know, it would make you think twice. And I think life has to take the foremost importance in preserving life and such. And then, but Lyndon's right. Now that we know a lot more about the virus, are there safer ways to try and reintroduce the economy, open up the economy? And we are, right? And as a result, we're seeing a slight increase in infections, but we're not. I don't think the government's shutting down anything at this point. The universities are still open, the schools are still open, businesses, restaurants are still open. Gyms have reopened to some degree, although many of the gyms are practicing under different guidelines in terms of, you know, many of them are not. Many of the organizations, the PSOs, are not in Ontario are not allowing sparring, for example. So there still are things that are not ideal and are probably impacting gym memberships. People are probably not paying, you know, coming to join gyms because of these restrictions. It's scary, but I just don't know what else we could have done. And I feel for Lyndon, I feel for Parabellum 100%, but I don't know how we could have done a better job. I think at the time this all happened, we had to shut down some businesses and gyms to try and prevent this from escalating, and I think it has saved lives.
As someone who's worked closely with the UFC and varying levels of mixed martial arts with events and promoters and that, what did you think when Dana started to put on events again and he was wanted to be the first one out there? Do you think he was a little bit nuts, or the way he was going about it, did you think that the outcome would be as positive as it has been?
You know what? I give that guy full credit. I mean,
yeah,
he saw a problem and he tried to find a safe solution, and he put every safety protocol in place that he could. You know, I think everyone involved with the show is being tested 3 or 4 times.
Yeah.
They're being screened carefully. You know, everyone's wearing masks. There's no big audiences watching the event. He opened up a whole new fight island in a remote place and avoided overcrowding. Yeah, you have to give the guy credit. Like I give him a standing ovation from my perspective. Did he take a risk? Absolutely. But he tried to deal with this pandemic in the most responsible way possible. You know, I'm the head physician for the sports commissioner of Ontario for combat sports. And, you know, we have talked about the fact that there may be some promoters wanting to do events similar to how Dana White did them with testing and stuff. And so we may have to come up with protocols. The reason nothing has happened, because, you know, people make money from people coming to watch the fights. Dana White has a big pay-per-view component. He's got big advertisers, right? So if Joe Blow promoter wants to hold an event in Ontario, he can actually, and probably our commission would have to come up with our own protocols to develop. But the fact of the matter is they can't afford to. So I don't see anything in Ontario changing unless they're funded by UFC Fight Pass or by a bigger promotion in the United States to allow people to do the testing and all of the tight protocols that are required, because without an audience, you can't make money.
Yeah, absolutely. Is it expensive to do the testing, like in terms of sports, or does it not change from sports to regular person?
You know,
Sorry, go ahead.
There's two separate questions there. So just to do the medicals, MRIs, EEGs, blood work, and all that, it's more of a pain in the ass to actually access them sometimes, because MRI wait times are long. You know, not all athletes have family physicians who are willing to do these blood tests for them. Some charge, some don't. So the testing, just to get your license, is a pain. The COVID-19 test is provided by free of charge. Wants it right now. The issue is you have to go to a screening center and get your test done. And typically you'll get the results back within about 48 hours, hopefully 24 hours, but sometimes it's been up to 48 hours because they can't handle the volume of samples that they're getting right now, for example. So if we were to hold a professional MMA event, let's say in London, Ontario today, we could get COVID-19 testing for free by the athletes just going to the screening centers. So there would be no cost for that test.
Okay.
Now, what's the cost to the taxpayer? I don't know. Actually, I don't know what the cost is per test to the taxpayer. I should, but I don't.
Okay. And I know that we got to get you out of here soon. You have a lecture coming up, so let's have at least a little bit of fun. We have to have you back again soon. Hopefully, when times have calmed down and we can have nothing but fun. But so UFC outside of the Ontario mixed martial arts scene, we got Khabib Nurmagomedov and Justin Gaethje coming up. How does a fight like that make you feel? Does that get you excited? Does that get your blood going?
I love it. Absolutely. I love that fight. I think it's going to be a barn burner. I think, there's always a question. Gaethje's got such tremendous power, and he's a very good wrestler. So will he be able to negate Khabib's takedowns and land one of his shots on Khabib? My feeling is that, Khabib will dominate with his superior sambo wrestling and probably take him down and smash him like he does all of his opponents. But exactly. But Gaethje's such a tremendous athlete and tremendous power and a lot of heart, and his wrestling is high level. So it's going to be I think an excellent fight. Excellent. I can't wait to watch it.
Yeah, me too. I what I love about this fight, I mean, if I have to, forced to make a pick, you got to go with Khabib. We haven't seen him lose more than a minute of a round in his entire career, or something ridiculous like that. But there's still the level of unknown is very high in this fight compared to past people that Khabib has fought. And that's not a knock on any of those guys, but this one, it makes for a real interesting matchup. And if Justin can keep it standing, I think Khabib is in a world of problems. But I mean, who's kept it standing with Khabib so far? Nobody. He just treats people however he wants. Yeah, he is incredible. Exactly. And you see people Khabib really wants it too for his retirement fight. Him versus GSP. As a guy who's very familiar with Georges St. Pierre. Sorry, go ahead.
No, I was just saying that would be the one to see. That, you know what I mean? I'm excited about Gaethje, but GSP and Khabib would be insane.
Yeah, but remember, Dana White said he has a surprise after this fight, right? I think there was some sort of announcement that he may be able to make that happen. So if Khabib beats Gaethje, I bet you he fights Georges St. Pierre.
That would be
incredible. I bet you that's what's going to happen. I think it would be incredible. Again, I don't know. George is probably one of the best MMA wrestlers ever. Yeah. So it'll be really, really interesting. It's kind of more of an interesting fight, and I think that would be a barn burner, and it would be, the fans would love it for sure.
Another fun one that we got coming up in boxing. Just a couple old timers, Mike Tyson and Roy Jones Jr. Did you grow up watching those guys when you were younger? Were you fans of them? Because I assume,
absolutely. Yeah. I still remember when Tyson won the world championship for the first time at 20 years of age. The guy, he was just a phenom at that time, and Roy Jones' hand speed is second to none when he was in his prime as well. I think this is, and this is my own opinion. I apologize not to be a downer, but I think this will be a circus show kind of thing, and they're both way past their prime. Roy Jones Jr. looked terrible his last couple of fights, and Mike is over 50. So I think it'll be fun if you're just there to have a fun and watch it. But I don't know if it'll be how high level it'll be. I know Tyson looks good hitting the pads, like he looks really sharp, but we're only seeing 2 second, 3 second shots.
Yeah, I had Ron Frazier on, Randy Couture's old boxing coach, like last week or the week before, and he was saying, Tyson looks great hitting that bag in those videos, and he said, but for someone like him, who trains professional boxers, he trained Randy Couture. I mean, you know what I mean? That says it right there. And he said, for someone like him, when he watches that video, he sees things. It's not the same guy. You're not going to see the same person out there come fight night that we're used to from 15, 20 years ago, whatever it may be.
Well, of course, they're all, both of them, right? But look at that's what I'm saying. I don't know about Roy Jones. I haven't seen him lately, but Mike looks like he's into some next level steroids. You know what I mean? He looks like he just turned 35. You know what I mean? But his body is he looks like he's insanely ready. But obviously, it's not the same man. I just think that Jones got himself in trouble though, but the way the Mike's preparing, maybe Jones is not being as commercially published. You know what I mean? Everywhere, all over the place, as Mike is. But looks like
Yeah,
Mike.
so I think you've hit it. You hit the nail on the head there. I think the main interesting thing is which old timer has still got something left. Is really what you're saying. Which grandfather will still be able to kind of pull out enough to do it. And you know what? I don't know. I mean, Roy Jones took a lot of damage in his last few fights, and Tyson's been retired. I don't know if that will have an impact. But I think Roy Jones is a bit younger. I don't know the age difference between them. I suspect he's a bit younger, and that might be a thing. But Roy Jones has looked terrible his last few fights. And Tyson didn't look that great either, his last few fights. But I think Roy's taken a lot of damage. So I think it'll be interesting to pick who will look better. And maybe I would, maybe I'd be willing to give Tyson a bit there, but it's hard to know. You know, Tyson relied on power and speed, and you tend to maintain your power. Roy Jones purely, I mean, he had power too, but he purely was a speed guy, right? Reflexes and speed. And that's why he was world champion for so long. And as soon as he lost that, and I mean, you kind of saw the signs of that when he fought Tarver for the first time, and then all his fights after that fight, he lost his hand speed, and you know that happens as you get older. But one of the things that you don't lose is your power. Maybe I'll give the edge to Tyson for that reason.
Yeah, it's the last thing to go. That's what they say. Speed goes first, power goes last.
Exactly, and you know George Foreman's proved that. Some of the, you know, absolutely the guys who depend on their power I suspect can keep their careers going a bit longer. But speed, if you purely rely on speed, you tend to have to retire a bit earlier.
Yes. All right, Faisal. It's been nice chatting with you. I definitely want to do this again sooner than later, but I also want to let you get out of here so you can make it to your lecture on time. Is there anything else you want to get in here before we let you go?
Well, I just want to thank both of you guys for having me on. I love your podcast, and I appreciate being a part of it. And I just want to wish everyone out there who's listening, you know, good health and patience. And I'm very hopeful that we'll get through this pandemic and be able to return to a somewhat normal life.
Very good. Thank you very much again for joining us. For Dr. Faisal Rehman, for Kirill Kasatskiy, I'm Jay Kelly. This is the Billion Downtown, and we out. Peace.
Building downtown. Building downtown. Building downtown. Building downtown.